Hi, my name is Jacob Perez, and I'm an athletic training student at Carroll University. Today, my presentation is going to be on health informatics and how it can be applied to athletic training. So the main case study of my presentation that we'll be looking at is informatics supported diabetes prevention programming in West Virginia. So just a little bit of background information. Just in general, health conditions should be reported by healthcare professionals to improve public health overall. So athletic trainers, all other healthcare providers, we should all strive to increase our documentation using our health informatic databases and other tools. So that way we can report our findings to better help the better population. So when we identify risk factors for health conditions, we need to use that information to identify at-risk individuals. So one way we can do that in today's age is we have informatics software that analyzes healthcare information and can help us use these risk factors, identify individuals who are at risk, and then the software will then notify us as health professionals. And that way we can intervene and try to prevent these conditions from either further developing or starting in the first place. So this particular case study used health informatics and it collected data out in West Virginia. The reason that they chose West Virginia for the study for the diabetes prevention program was West Virginia has a 15% prevalence of diabetes compared to 10% nationally, so about a 5% increase. This data was collected for healthcare professionals and community-based programs in order to help treat, refer, and track at-risk individuals for developing diabetes or who already have diabetes. So it's important to recognize that for them to achieve this, that they had a connected group of healthcare providers working in conjunction with community-based programs. So they needed to work together professionally in order for the overall goal of reducing the risk of diabetes and the prevalence of diabetes in their area to be achieved. The West Virginia Health Connection Initiative is probably the biggest part of this case study, and it was started so that it can supply healthcare providers with analytic tools to identify and prevent their local communities from developing chronic diseases like diabetes. It's important to note that it used a clinical community linkage framework, and that was comprised of primary care and safety net clinics, local health departments, quality improvement focused state-based organizations, and academic partners all working together interprofessionally and effectively in order for them to achieve the common goal of helping our patient population. So the goal of this study is a more integrated data-informed healthcare system in which the health systems and community-based organizations work in tandem for improved population health outcomes. So how did they achieve this goal? So they used a secure online software called Workshop Wizard. And basically what it did was it linked patients to appropriate chronic disease programs, the community-based programs that I referenced earlier, and ensured outcome measurements were shared with referring providers. So it's important when we do studies like this to be able to measure our outcomes and track our progress. That way, if we have positive results, we can show how we got there and how we measured those positive results. The data was not only tracked in terms of cataloging available programming and referrals to workshops, but also the participant level attendance, which is important because we want to see if high adherence to these programs has a correlation to decreased risk of diabetes or increased management of the diabetes that is already present. Outcome metrics, which I just discussed in the previous bullet point, and customized participant surveys. This is an important thing too, because we need to incorporate patient rated outcomes into our evidence-based practice in order to see how our patient population feels about the treatment that we are providing to them. Even if we feel it's beneficial and we see beneficial results, it's important what they think as well. So then they took the data from the Workshop Wizard and exported it to a JMP Pro 14, which is a statistical discovery software. And it's a statistical analysis system. So the data was also analyzed for return on investment. So return on investment was it feasible to conduct this study? Can healthcare organizations, can healthcare providers and patients all benefit from programs like this, like the diabetes prevention program that they're studying? For the return on investment, use the CDC Prevention Impact Toolkit, which is another health informatics software that's going to help them manage and track the return on investment following the results of their study. So the return on investment indication markers that they used for the analytics software were diabetes incidence, medical costs, net costs, and cumulative quality of life address here. So all that last one means is how many more years of quality life are patients expected to gain from the program. And it also just talks about improving quality of life overall. So for the methods, they looked at demographics and anthropometric measurements. So in table 1, you can see just a table of what they were looking at. So they gave everybody an ID. They calculated age, gender, race, ethnicity, their first weight, which is important because they're going to check their first weight and their last weight, because weight is kind of an indicator of, you lose weight and you can help manage your diabetes better. First body mass index and the last body mass index kind of goes hand in hand with what I was just saying about weight. Weight difference, so the amount weight lost, the body mass index difference, and then percent weight loss and session identifier. So that just tracks them throughout their different workshops. Table 2 is going to show us the actual participants. So you can see that it varies in ranges, it varies in sex, and it also varies in ethnicity. So it's a great group of people to conduct this study on because we have a wide variety for our population. So the results. So examining data, there is a clear association between weight loss and time spent participating in the National Diabetes Prevention Program. This stands to reason as participants have more opportunity to lose additional weight as National Diabetes Prevention Program sessions continue. So it said that the studies have shown that if you go and participate in the programming, you will lose additional weight and it can help manage your diabetes better. So it was actually proven their hypothesis, so that's awesome. On average, the participants lost 6.3% body weight, which is pretty impressive considering the CDC wants you in that 5 to 7% range that I'll mention in a little bit. So the changes in weight obesity is straight from the article. 80.3% of the initial participants were obese, about 20% were overweight, and only 0.3% were at a normal weight. So that just shows the high incidence of diabetes in West Virginia and the population that they have conducted a study on. But the 0.3% is pretty interesting considering how many people they had and the positive results that they've seen. Also, there was an average weight loss of about 13.6 pounds per person. So return on investment, like we were talking about earlier. So the return on investment calculated for this study was there was a decrease in incidence of diabetes with more decreases projected in the future with the diabetes prevention programs. So 2, the net cost, which is the cost of the program minus the healthcare savings produced by the program. They're shown to initially start to be high in the beginning where they're actually losing money because they're putting money in to start the program. But by year 10, they're projected to have $651 profit of revenue per participant. So that's great because now the healthcare organization is happy when we show them this data that they can make money off of this, which is important because healthcare, unfortunately, is a business. So we have to look at the business aspect of things sometimes apart from the healthcare. So the quality adjusted life years that we mentioned earlier were 0.2 at year 1. So still positive increase. 0.2 is not a huge number, but 0.2 is still good because we're in a positive direction, but it's projected to get to 4.4 by year 10. Now, this is because they're predicting that every year they will get better and more thorough about their prevention programs. They will work out all the kinks that they didn't do right the first time, and it's just going to get better and more efficient overall time after time after time. And the biggest thing now is, to me, is it decreased the medical cost to the patient. So that's important. So now we talked about the net cost that's going to help the healthcare organization, improving the quality of life and the decreased medical costs. Those are both for the patient. So that's awesome that everybody's benefiting from this. So about $120 was saved per participant at year 1, and $989 will be projected by year 10 savings for the patient. So now healthcare organizations can say, all right, we're going to take this information and we're going to present it to future populations that might benefit from these programs. And by doing that, they can say you're going to save money by actually doing this, and it's going to make it more affordable to maybe these programs weren't affordable to patients prior. But now maybe it's in their price range because as it continues to grow, the prices will come down because they're becoming more efficient. So in conclusion, for the West Virginia Diabetes Prevention Program, the Health Connection Initiative has supported an increase in the number of recognized National Diabetes Prevention Program locations in the state from 11 in 2017 to 16 in 2020. So that's great. So we went from 11 locations to 16 in just 3 years. All right. So it doesn't sound like a big difference, but you know, those 5 locations can change a lot of people's lives. They can put it in different communities that'll be able to touch different people. And it's great that it's growing, and it's going to keep on growing and spread out and hopefully work to decrease that overall incidence of diabetes in West Virginia. So as of May 2020, there were 668 individuals taking part in the diabetes prevention program within 8 healthcare systems comprising of 16 locations, which were being tracked through the Healthcare Connection. So it's important to realize that there's 8 health systems and 16 locations. So it just shows you that the 8 health systems are working together for this program, which sometimes we see there are things where systems don't like to work cooperatively with each other because they're in competition. That's not the case here. And ultimately, when they don't work together cooperatively, the patient is the one that feels the residual effects of this, because if they're trying to transfer data or trying to go from one program, from one system to another, they could run into paperwork barriers and bureaucratic things that they don't feel like have taken the time to do. So it makes it a lot easier for the patient when the health systems are working together and they can use this program across multiple healthcare providers. So coming from the article, it says these changes represent decreased risk of diabetes incidence and increased healthcare savings. Lessons learned are applicable to other areas aiming to build and sustain a data-informed health analytic network. So it's talking about health informatics, and it's going to help build, sustain, and eventually, you know, improve on a data-informed health analytic network. So it's awesome. We're using our electronic medical records, and we're going to create a network that's going to work cooperatively with other health systems, all for this diabetes prevention program that we can look at, and it can be applied to many other things besides diabetes. So projected return on investment numbers are not guaranteed, but if the initiative continues to grow and move in a positive direction, the numbers can be even higher than projected in the beginning. Those year 10 projections can be even higher. It all depends on how efficiently that they are progressing and how much more support that they have. So the next case study that I'll be talking about that kind of ties into the last one is overcoming challenges of merging multiple patient identification and matching systems. So this goes back to when I was talking about multiple health systems have different electronic medical records. And sometimes when they need to work together or they decide to merge medical record systems, it can be very troublesome for the people in, you know, the IT department and the health informatics faculty, because it's hard to combine these 2 softwares and keep all the patient data the same in the process. So there was a study at a medical center in Northeast Alabama, and it talks about the challenges that they faced when 2 hospitals merged together, and they had 2 different healthcare databases and informatics systems that needed to be combined. So they combined both of the electronic medical record databases, and they created what was called an Enterprise Master Patient Index. So they used that for the health information management, and then the IT departments worked cooperatively with that health information management. So coming from the article, it says impacted areas such as financial and accounting systems, purchasing and supplying systems, pharmacy, radiology, laboratory, and human resources systems require active reconciliation. So we need to work together to be able to create this new electronic medical record system that is more efficient and more beneficial to all parties involved, but we need to work together in order to make it happen. So The multiple patient identification is the foundation base for all electronic medical records. And it's very important that all this information is accurate because this is sensitive patient information. The key points on lessons learned and recommendations during the conversion include the right staff, cleanup of the MPI that we talked about, the patient identification, knowing the workflows, consolidate systems, interface to automate, and source of truth. And the source of truth is just sharing between computers in the same network. So all the computers in the hospital need to be able to work together cohesively and seamlessly, so that way it's less troublesome on IT problems. So the challenges that they identified when they did this, and maybe room for improvement, is more concise decisions need to be made by leadership on how to organize the new system after merge. So you have to have correct leadership in order to make this flow smoothly and to get everything that you need to get accomplished. Also, another challenge was developing a software that's able to detect duplicate records after the merger, and then confirming this information with patients post-merger. So you want to make sure that after you combine all the information that you don't have two of the same person in the database, because now that they connected, maybe it got transferred over and copied twice. So you want to make sure that you have another software that's going to be able to go through that database and make sure that there are no duplicates. And then also to confirm with your patient population that all their information is correct after the merger. So another article that I found was talking about partnership to promote interprofessional education and practice for population and public health informatics. It's another case study. And basically it's talking about creating an interprofessional connected network. So it's very important that we work together interprofessionally, not only from the IT side and the health informatics side, but also us as healthcare providers. So that way we can make sure that our records are up to date, they're able to be shared with the patient easily, and that they are using the most resources to be able to help us as tools for healthcare professionals to provide the best care and the best evidence-based practice. So this case study was from an informatics program and their academic health center at the University of Minnesota and the Office of Health Information Technology at the Minnesota Department of Health. So it presents an academic practice partnership which focuses on both interprofessionalism and informatics. So this is an important flowchart, and it's basically going to explain everything that this study showed. So you have on this side, you have the Minnesota Department of Health. And then on this side, you have the University of Minnesota Academic Health Center. So the Academic Health Center, it's where, it's a home of 6 colleges and schools, 90 centers total, more than 90 actually total. And basically, they're connecting these 2 departments to work together interprofessionally. And what they're going to do is they're going to do this through coordination, cooperation, collaboration. And the outcomes that we see from this is there's a collaborative curriculum development and teaching in biomedical health informatics. So in the process of them doing all this, they're teaching the next generation of health informatic professionals, because the students are able to see professionals that are already working in the field and the progress that they're making. So they're hosting practicums and teaching other students about what is going on and helping them to work better with healthcare professionals that are students as well. So on both sides, the health informatics students and the healthcare students can work together, and that way they can work together better interprofessionally in the future of healthcare practice. So another outcome was partnership for informatics research across professions, practice, and academia. So not only in our hospital settings, but also in our school settings, just making sure that it's a partnership. Practicums, like I mentioned, to promote interprofessional experience and informatics competencies. So making our healthcare providers understand what health informatics are, because some of them may not understand it. It's still growing and it's still new. Service and sponsorships to advance biomedical health informatics, and then collaborative environment to facilitate a learning health system. So a health system that's going to keep on growing from its previous mistakes, and a health system that the health informatic faculty can keep on using their information and their schooling and their experience to keep on improving it to help us as healthcare providers. So by working with Academic Health Center, they're allowing these health informatic informational practicums to be held, and that's how they're going to educate the future students in the field of health informatics. And it's important to realize that both of these sides have different missions, and they're working together because their goals overlap, which is mutually beneficial to both parties. But their goals overall is to create a better health informatics system that will better aid our healthcare professionals in ultimately treating our patients. This is just an example about interprofessional education and collaboration can excel healthcare. If we educate each other on what we do and what we're good at, and we learn how to work together and refer to each other and lean on each other, it will ultimately help make us a stronger and more connected healthcare system overall, and also be able to help our patients better. So interprofessional collaboration was deemed essential to further development of biomedical and public health informatics. So it's an essential component of us being successful, is us being able to work together better. And both sides have said that after working together and starting this, that they both are working better and they have benefited from working together. The success, they said, was achieved through solid informatics emphasis, committed leadership, and knowledge integration in both academic and practice settings. So for the discussion, why are health informatics important? Why is it important for us to have these medical records and these apps that can ask our patient questions, and for us to identify risk factors? Like, why is this all important? Well, it's like I was just saying, if we have all of this information, a database that can take this information and analyze it for us with tools that we present to it with our health informatics faculty, then it can use those tools that we have given it to analyze everything and maybe catch things that we have missed, or just aid us in our professional practice to give us better evidence-based practice and provide better care to our patients overall. How can these various case studies tie into athletic training? So that's a very good question. Everything that I've been talking about so far has had to do with hospitals and big healthcare systems. Like, how does that apply to athletic training? We are healthcare professionals as athletic trainers. It's an important thing to realize. We might get overlooked, but we see our patients every day in most settings, and we are sometimes the primary care provider for our athletes and our patients. So can health informatics improve our patient interactions? Yes, of course. We can use it for better documentation. We can use it for injury prevention. We can use the same identifying risk factors that they use for the diabetes prevention program and apply those to maybe an Achilles rupture. See if people are more at risk for an Achilles rupture. See if maybe people are more at risk for a hamstring strain because they have had previous hamstring strains in their past, in their medical history. So we can use these health informatics softwares to help us as well, and not just other healthcare professionals. It can help all of us together as healthcare professionals, because we want to provide the best care to our patients, which happen to be, most times in most settings, our athletes. So can health informatics be geared to improve athletic performance? Absolutely. We can use these informatics to log and track progress in performance. We can use this in the weight room. We can track how much weight our patients are progressing on with their rehab. We can upload, position statements from NADA and use that information to make more phased rehabs and get recommendations from our health informatics software in order for us to provide better treatment for our athletes and rehabilitation. It can help with things just like body composition goals. So tracking body fat percentage, like we saw in the diabetes prevention program, that can be used for our athletes. Look at wrestling athletes, or just a lot of athletes, just really care about their body composition. And we can use this for baseline testing for concussions. We can use this to track rehab process, like I was talking, and a whole bunch of other things that, the possibilities are endless. It's something to think about. The possibilities are endless with this, and we just need to work with our health informatics faculty and let them know what things we are looking for to try and track and progress. And they can help us put that into the electronic medical records and then help provide it to the patients, and they can see their visual progress instead of us just writing down everything and things get omitted from those documentation naturally due to human error. This would help to eliminate some of that and provide better care overall for our athletes. So Starting a health informatics system from the ground up versus combining multiple systems and merging them into one system. So it's important to realize that they're two different things. So if you start your health informatics system from the ground up, you have a lot of wiggle room, but at the same time, it could be a lot of work to start this and combine it with your electronic medical records and get all that going. But it also can be very troublesome, as we've seen when the two hospitals merge together. That's very hard. You have to get all the patient identification records on the same page. And it's just something to think about, that there's challenges to both, but they're both beneficial at the same time. So how does improving interprofessional communication through electronic medical records and healthcare informatics in general improve healthcare as a whole? So like I've been saying, if we can talk better interprofessionally to each other as healthcare professionals, and then talk more so to our IT and our health informatic departments, we can work to make our electronic medical record system better overall, and where it's patient-centered, but with a clinician emphasis on how they want to treat their patients. So how can health informatics be improved and made more accessible? So communication software to connect different healthcare organizations is something that I think there is a lack of in today's world. So many different healthcare organizations have different softwares, and sometimes these softwares don't communicate with each other nicely, and it's hard to share data. We need to find a way to make everything more seamlessly, so that way our patients have an easier experience, going from one healthcare provider to the next, because everything will transfer over seamlessly. That's just one thing to think about. It's something that it's still developing now, so I'm sure we'll see it in the future, but it's something that could be very beneficial for everybody. And then lastly, how can healthcare professionals, healthcare organizations, and patients all benefit from health informatics? As we saw in the diabetes prevention program, look at the healthcare professionals benefited because they were able to provide better treatment to their patients, and the health informatics provided them with better data than maybe they had previously and analyzed it for them, saving them time. The healthcare organizations were projected to gain money at the end, and the patients improved their quality and estimated life, and they also decreased their overall costs. So that's amazing. If you think about all three of those things just from that diabetes prevention program, we can apply that to our athlete population, where we can benefit, our governing body can benefit, and the athletes can benefit all together. So just a little more about health informatics and athletic training. So it can just be as beneficial to us in the athletic training facility as it is in a hospital setting. These data analytic tools can be used to improve rehab through tracking our patient, our athlete's process. We can identify risk factors for injury or just chronic illnesses in general. The possibilities are endless. Like I was talking about earlier, we can talk all day about the possibilities because there are just so many. So that means that there's a lot more work that has to be done, but that's also exciting because we can continue to grow and improve our healthcare and improve performance for our athletes overall. Interprofessional collaboration between athletic trainers and health informatics departments is necessary to efficiently achieve this. So it's the same thing I was talking about earlier with the hospital staff being able to communicate with that health informatics staff and be able to work together to create their database how they would like and to analyze the things that they would like as well. I think another thing about the interprofessional collaboration is that we need to be able to work with other healthcare providers as well. If we're working at a like training facility and we were referred one of our athletes who went to physical therapy over the summer, we need to get those records to see how they've progressed. And then if we have an informatics database that is connected, it'll be easy for that therapist, that physical therapist, to transfer over those records to the athletic trainer once the season starts. And it will help the interprofessional communication between both. A more collaborative electronic medical record system can help athletic trainers work just interprofessionally overall, with orthopedic surgeons, with nurses, physician assistants, medical doctors, all different types of other healthcare professionals, chiropractors, physical therapists. All of us can work together better if we have a more improved electronic medical record system and a better health informatics system overall. So some key takeaways from my presentation is Health informatics are an important component in improving overall evidence-based practice. So remember, for evidence-based practice, we need the patient's values and what they want overall. We need the best clinician experience from the healthcare professional, and then we need to also incorporate the best relevant research. So this research is showing us that if we use the health informatics, it can help improve our evidence-based practice. So the research is a big part of evidence-based practice, and the research is showing us that this health information database can help us analyze and improve our quality of care to our patients. Can use to be collect patient data to identify, treat, and track these patient progresses for various disease preventions, management, or the performance goals. Many more possibilities are available too. The studies like the diabetes prevention program have shown a great return on investments that can be beneficiary to the healthcare providers, the healthcare organizations, and the patient. There's plenty of room for growth in this field because it is still new and growing, and that means it's exciting, but we just need to make sure that we're working together when we create this foundation that could potentially launch us into the next century. We also, more research needs to be done on electronic health records, which are patient controlled, and electronic medical records, which are the hospital controlled or healthcare organization controlled, and they need to make sure that they can be seamlessly compatible for ease of access. They have been proven to be successful. I just showed 3 case studies that showed that these were all successful in health informatics, and there's plenty more studies that will show the same thing. So there's positive results and positive studies being done, and we need to apply that to our practice. Healthcare organizations, professionals, and the patients, like I said, we can all benefit from each other. And so much of our jobs as athletic trainers is to treat and like examine and assess the injuries of our athletes. But the health informatics can be used to help take another step forward and improve the prevention of this. So on top of, we have great examination assessment tools, and health informatics can help with that too. But health informatics can be used as a prevention tool as well, instead of an examination and analytic tool. It can be used to, analyze prevention data. So that way we can identify our athlete populations who are at risk for high incident injuries. Just like they said, diabetes was high in West Virginia. Maybe they say that a particular college basketball team has a high incidence of ankle sprains. You work with your health informatic faculty and set up a program to electronically upload and identifying risk factors for those ankle sprains. And then now we can prevent those ankle sprains from happening next year because we identify at-risk factors and use the health informatic databases to provide better care to our athletes. So I hope you guys liked my presentation and now understand why health informatics are so important to healthcare, but also to us as athletic trainers in general, and how more studies need to be done in the realm of athletic training to apply what we've seen in other studies to performance. All right, we can improve by adding patient-rated outcomes, clinician-rated outcomes, and have it all seamlessly on our electronic medical records. Thank you guys for listening. My name is Jacob Perez. Like I said, thank you guys again for listening. These are my references, and I'm all done.